Welcome back. South Korea is looking ahead to a long weekend starting tomorrow, that is Friday, as we celebrate this year's Chuseok. Accordingly, on Viewpoint today, we address efforts to ensure a safe holiday amid the ongoing pandemic. For more, I have Professor Kim Moon Kyu from Yonsei University. Professor Kim, thank you for being here.
Thank you.
I also have Doctor Kim Seung-taek from Institut Pasteur Korea. Dr. Kim, it's good to see you again.
Good afternoon.
Professor Kim, this is the first Chuseok in the absence of most COVID-19 restrictions amid the pandemic, but there are concerns that the daily tally may spike after the 4-day holiday. Do you share these concerns?
Usually, after the long weekend like Chuseok or the New Year's Day, we have a mild increase of cases. And I'd like to quote from a famous historian, Arnold Toynbee. He said that human history is a history of challenge and response. So if I substitute this quote into our situation right now, I would say it's a fight against BA.5 of Omicron against humans' reaction, people's reaction. So BA.5 is very highly contagious, but doesn't cause so much severe cases. And that's not the only thing we have to mention. The other one is the people's reaction. And I would like to say avoid 3 C's. So the first C is avoid a confined place, and avoid a very crowded place, and avoid close contact. So I wish that people remember as this. And well, we have to go back to the basic. The personal hygiene is the most important thing. Even though our government will ease the quarantine measures, there are some people who need to be very careful, the elderly and the person with underlying conditions. So I wish that everybody will be safe through this Chuseok holiday, and I do believe that the daily tally will rise a little bit, but eventually it will decline.
Right, hopefully, of course. Yes. And speaking about the daily tally, Dr. Kim, it appears as though Korea is past the peak of this latest wave ahead as we look ahead to Chuseok. Do you agree?
Yes, and all the numbers and stats are actually indicating that we are in the some decline in just the phase of COVID-19. But then, as Dr. Kim, Professor Kim said, after maybe Chuseok holidays, just people just get together. I mean, from many differences. So then, just sharing foods, and after just a long talk, there is some chance of just a spike after that Chuseok holidays. And in the future, we have to somehow expect this COVID-19, this infection, will just going up and down, and that probably depending on the maybe from future or emerging just variant, also some our just immune status. But then the best thing at this moment is that we have to just keep the vulnerable people, like some elderly people and the immunocompromised people.
Right. And Professor Kim, we have been told that a total of 6,000 COVID-19 care centers will be open during the 4-day holiday that we're looking ahead to. Could you tell us a bit more about the role of these centers and what people can expect from visiting them?
Yes, already there are many centers, but especially through this Chuseok holidays, there will be a screening center at the highway rest stops and areas even affected by this big typhoon. And number one priority is let the patient with underlying conditions or elderly have a quick diagnosis, and they should have an access to medication such as Paxlovid without delay. And usually we have to start the medication within 5 days of the onset of the symptoms. But if you keep on screening with the rapid antigen test, you might have a false negative result. So I recommend that people in age more than 65 or people with underlying condition, they should rely on PCR results. And detailed information is on the website, so you have to search the website if you need some information.
Right, I see. And Dr. Kim, for those planning to travel during the Chuseok holiday, which we heard in our news segment, more than 30 million Koreans are expected to hit the road. What are some emergency medications that people can take with them in the event of COVID-19 symptoms while on the road?
Well, there are actually very effective drugs against some COVID-19, including Paxlovid and then some remdesivir and then molnupiravir and then some monoclonal antibody, which is actually not available in Korea right now. But then there are some like Paxlovid and the molnupiravir is orally available drugs. But the thing is that these drugs are only available after prescription and then also just after confirming the COVID-19. So this cannot be something that we need as some sort of just emergency cases on the road. So that what would just recommend is that maybe you can just carry some the drugs for some common cold. That actually somehow just relieves the symptoms that we actually may just experience after COVID-19. But other than that, maybe just testing as soon as possible and getting just a prescription is just the best way. And also, if we just plan ahead, maybe now it is just a little bit late, but if we can just plan ahead, maybe just being vaccinated is maybe just the best option we can take. For example, like at least 1 or 2 weeks before departure.
Right. And Professor Kim, this may sound like a random question, but on the subject of emergency medication, there has been quite a bit of talk about ginger and its alleged benefits against COVID-19. Since the start of the pandemic, is there any truth to this belief?
Well, there are many remedies for COVID-19, and I would like to categorize into two. One is specific, and the other one is non-specific. And as we all know that COVID-19 causes huge inflammation, any remedies that was believed to cause anti-inflammatory or antioxidative effects, they were on the table to discuss about. So usually vitamin D, vitamin C, or zinc, those kind of things are considered as a non-specific remedies, even not only for COVID-19, for other kinds of common flu or infections. Before diagnosis of COVID-19, you can have whatever you want, ginger or those
vitamin C.
Or whatever I mentioned. But as it follows the personal preference. But since you considering a possibility of COVID-19, you better have an accurate diagnosis. And once you are diagnosed, and if the doctors consider for specific treatments, just as Dr. Kim mentioned, you have to put the priority on those specific treatments. And if you want to add on something with those specific treatments, you can follow your personal preference. But I do want to say that some people would like to just take ginger and not take anything else. That's not wise to do.
Right, I see. Dr. Kim, as now we prepare to, of course, usher in Chuseok this year, we've heard health authorities highlight the importance of testing, especially before visiting elderly relatives. And that being said, what are some symptoms that should raise alarm bells, symptoms that tell us that we should go and get a PCR test?
Well, the reason why we are actually talking about some elderly people is that they are actually vulnerable, even after some multiple vaccination. So the people who are actually visiting elderly, the parents, actually maybe we can get some precautions. Like you said, maybe testing before visiting our elderly people. And also, as I told earlier, maybe vaccination, like at least 1 or 2 weeks before visiting our parents might be very, very effective against preventing any potential COVID-19. And then for the symptoms, well, the COVID-19 symptoms is kind of maybe early symptom is it's not really easy to distinguish from the other some common cold symptoms. And now this is also season for some allergies like sneezing and then a little bit fever and then some cough and then sore throat. Maybe a little bit difficult to distinguish from other symptoms from the allergy and also common cold. But I think if the people are some vulnerable people, then maybe once they feel such kind of symptoms, I would recommend to get getting just tested for the COVID-19.
Right, just to be safe then.
Sure.
Professor Kim, back on the topic of tallies, the number of COVID-19 patients in critical care has been hovering on and slightly below 500 as of today. Could you give us some perspective on this particular figure? I mean, how does it compare to figures for people in critical conditions with other diseases?
Well, before COVID-19, the ICU beds were already overloaded, crowded, and I was thinking that compared to our population, ICU beds are not so enough. We didn't have enough beds for critical patients already. And COVID-19 put a big burden on that trouble. So as people live longer and they live with conditions, underlying conditions, so that makes more people being in a critical situation. And Korea was lucky not to experience a huge trouble as United States or UK or some other countries experienced. Yeah, we didn't go through that kind of thing, but nobody knows for the future. So right now, the critical cases are declining, and I think it will continue to decline, and it will be in a manageable situation. But if a new variant emerges, or if a new kind of infection like COVID-19 or even MERS or something serious happens, we are not that ready to deal with that kind of a situation. So I wish that the health authorities understand that we need to empower the medical personnel and facility to deal with this kind of situation in the future. So yeah, you don't have to worry about this right now, but it's kind of a lesson, and we have to learn from the lesson, and I think that's the way we should go.
Right, we need to be better prepared for the future then.
Yes.
Dr. Kim, some concern has been raised about the possibility now of a twindemic this year. Do you share the sentiment?
Well, that word, the twindemic, actually occurred also just almost 2 years ago right now. That time, the people were concerned about twindemic of COVID-19 and also just the flu. And then last year also, there have been a couple of just occasions that, since the people are somehow just get used to just wearing just masks, some twindemic concern was, we actually did not suffer much about the some twindemic just cases. But then there are some small cases of twindemic, for example, caused by COVID-19 and respiratory syncytial virus infection. And then this is some human case of such a double just infection, and also there are some animal studies just double just infection by the SARS-CoV-2 and also influenza viruses. So the common outcome from those observation is that maybe if a person is maybe just infected by two viruses, very different viruses at the same time, maybe the symptoms got just worse, and then maybe some exacerbated the situation. So that what we actually suggested whether if the vaccines are available. Well, in this case, we are having the very effective vaccines against the COVID-19 and also just the influenza viruses. So that maybe just the vaccination may be the best way to can just cope with the potential twindemic. Right now.
So, Dr. Kim, essentially you are advising people to get both the flu vaccine and, if they haven't already, the COVID-19 vaccine as well. Yeah,
as far as I know, there's no just specific just intervals in between just those two vaccines. Some people say maybe just getting just the vaccine at the same time may not cause any problem, but just in case maybe 3 or 4 weeks or just at least a couple of weeks apart between the two vaccines might be just advisable.
Right. Professor Kim, now beyond COVID-19, actually, beyond that, I have a question about an outbreak of tomato flu, actually, among children in India, and it's raising quite a bit of alarm bells across the world. Could you tell us a bit more about the situation?
Yeah, it's very new for Koreans. We never heard about it, but it was there, endemic in an area, Kerala in India. The course is relatively mild, but at the beginning, we thought that it might be an after effect of chikungunya or dengue fever. But now we think it's not that kind of thing, and we think it's kind of a new pathogen, not yet understood yet. The symptoms are fever, fatigue, pain, and typically they have a skin rash resembling a tomato. And sometimes they have a joint pain, and sometimes they have gastrointestinal symptoms such as vomiting, abdominal pain, or diarrhea. If I compare with the disease we have in Korea, I think the hand, foot, mouth disease is the most similar thing, but they don't know what's the cause of this right now. Anyway, we have to be vigilant for this kind of infectious disease because we have a lot of communications globally. So, every time if there's a new variant emerge from COVID-19, we have it. So we should be vigilant, but it's not a life-threatening situation. It's not a totally new disease such as COVID-19, but prevention is the best choice. And I think transmission is very similar to other kinds of enterovirus. So if we keep on our personal hygiene, I don't think it's a big threat for Korea right now.
See. And staying with the tomato flu, do we have a vaccine or treatment specifically for this particular flu?
Not yet. We don't know the pathogen yet, so we don't have the vaccination.
Right, I see. Dr. Kim, staying with viral diseases, I understand that this may be a tough question, but generally speaking, how can we better prevent ourselves from such diseases?
Well, there are tons of very different kind of viruses, but mostly but do not harm us. They somehow very peacefully coexist with us. They sort of just the parasite. But some actually cause very severe disease. So for some prevention against some potential viral disease, we have to think about their transmission route. Some viruses use some respiratory transmission like COVID-19 and then the flu, and others are oral fecal route, and others are insect or tick biting, and then some contact transmission, and also transfusion. So when we actually consider very different kinds of the transmission route, we can actually deal with that viral infection just using our common sense. The first and the common sense, and then maybe just the first one, then we can actually defend ourselves from such a viral disease. If the vaccine is available, we can get vaccinated, and then we use some common hygiene like washing hands is very basic things. And then if this caused by some insect biting or things like that, we can use a repellent. And also we can actually wear masks, where some winter season where so many respiratory viruses are just hanging around all everywhere. And so using this kind of a common sense is actually just the best way to prevent viral disease. And then also we cannot actually prevent 100%, but we can actually minimize the risk of just exposing and then being transmitted by these viral pathogens.
Right, and this, Professor Kim, is an impromptu question, but Dr. Kim just spoke about masks, and quite recently the state of New York has lifted the mask mandate on public transportation. What are your prospects with regard to the fate of masks here in South Korea? When can we take them off? Can we ever take them off?
Well, I think if there's a guarantee that there's no more new variant emerging from COVID-19, I think that would be possible. But I'm sorry that I cannot guarantee. I think nobody can guarantee about that situation. So to be vigilant, to prevent something, I mean, I would think that mask wearing is still needed for public transportation. For elderly people, underlying conditions, they should wear a mask, even though the government will lift out mask wearing.
Right. And Dr. Kim, you spoke about that, is the importance of vaccination. Mm-hmm. Where do we stand on that front right now here in South Korea? I understand we have continuous efforts to further develop treatments as well as vaccines. What is the current status? Well,
we know the domestic companies like the SK Biosciences, and they developed and they started to distribute the domestic vaccines. But that vaccine is not just updated against the new variant, including Omicron, but then based on the many experiences and some clinical data we actually obtained so far, those vaccines still have some good effect. Well, maybe especially some cell-mediated immunity still retains pretty good preventive role, but also some antibody generated by the vaccines will have good protection levels against even the variant.
Right. In the time being, we need to wash our hands, watch our distance, and wear our face masks. Then, as Professor Kim has said, and we also need to avoid confined spaces, crowded spaces, and close contact spaces.
Correct.
Right, Professor Kim, have a happy Chuseok. Dr. Kim as well, thank you so much.
Thank you.
Happy Chuseok.